201. A patient with type 1 diabetes can develop hypoglycemia unawareness over time.
True or false?
Answer. True. Rationale. Frequent hypoglycemia can reduce symptomatic responses, leading to hypoglycemia unawareness, increasing the risk of severe episodes in type 1 diabetes. 202. A blood glucose of 60 milligrams per deciliter requires immediate insulin administration.
True or false?
Answer. False. Rationale. A glucose of 60 milligrams per deciliter indicates hypoglycemia, requiring fast-acting carbohydrates, not insulin, which would worsen the condition. 203. Metformin is typically stopped before surgery to prevent complications. True or false? Answer. True. Rationale. Metformin is held before surgery to reduce lactic acidosis risk, especially with potential renal stress or contrast dye use, per clinical guidelines. 204. Hyperglycemia can lead to increased thirst and urination. True or false? Answer. True. Rationale. Hyperglycemia causes osmotic diuresis, leading to polyuria and subsequent thirst, polydipsia, as the body compensates for fluid loss. 205. Diabetic patients should avoid wearing socks to promote foot circulation. True or false? Answer. False. Rationale. Properly fitted socks protect diabetic feet from injury and maintain warmth, supporting circulation, especially in patients with neuropathy. 206. Insulin glucose is a long-acting insulin used for basal coverage.
True or false?
Answer. False. Rationale. Glucose is a rapid-acting insulin for mealtime or correction doses, not long-acting like glargine, which provides basal coverage. 207. Diabetic ketoacidosis, DKA, can cause abdominal pain. True or false? Answer. True. Rationale. DKA often presents with abdominal pain due to acidosis and dehydration, a key symptom requiring urgent insulin and fluid therapy. 208. A blood glucose of 80 milligrams per deciliter before exercise requires a high-protein snack. True or false? Answer. False. Rationale. A glucose of 80 milligrams per deciliter needs a carbohydrate snack to prevent exercise-induced hypoglycemia, not high protein, which digests slowly. 209. Continuous glucose monitors, CGMs, require replacement every 30 days. True or false? Answer. False. Rationale. CGM sensors typically last 7 to 14 days, depending on the model, requiring replacement well before 30 days to maintain accuracy. 210. A diabetic foot ulcer should be treated with over-the-counter antiseptics. True or false? Answer. False. Rationale. Over-the-counter antiseptics can irritate diabetic foot ulcers, which require medical evaluation and prescribed treatments to prevent infection. 211. Type 2 diabetes is always associated with obesity. True or false? Answer. False. Rationale. While obesity is a major risk factor, type 2 diabetes can occur in non-obese individuals due to genetics, age, or other factors like insulin resistance. 212. A blood glucose of 350 milligrams per deciliter in type 2 diabetes always requires for insulin. True or false? Answer. False. Rationale. A glucose of 350 milligrams per deciliter may be managed with subcutaneous insulin or oral medications, depending on symptoms and setting, not always for insulin. 213. Insulin detamere requires mixing before injection. True or false? Answer. False. Rationale. Detamere is a clear insulin that does not require mixing, unlike cloudy NPH, ensuring proper administration without agitation. 214. Hypoglycemia can be prevented by carrying a fast-acting carbohydrate source. True or false? Answer. True. Rationale. Carrying glucose tablets or juice allows rapid treatment of hypoglycemia, preventing severe episodes, especially for insulin users. 215. Patients with diabetes should avoid all grains to control glucose. True or false? Answer. False. Rationale. Whole grains, when portion-controlled, provide fiber and stabilize glucose, making them suitable for a balanced diabetic diet. 216. Diabetic retinopathy can be managed with tight blood pressure control. True or false? Answer. True. Rationale. Hypertension worsens retinal damage, so tight blood pressure control, alongside glucose management, slows retinopathy progression. 217. A blood glucose of 90 mg per deciliter at bedtime requires insulin in type 2 diabetes. True or false? Answer. False rationale. A glucose of 90 mg per deciliter is within target range, 80 to 130 mg/dl, and insulin depends on the patient's regimen, not automatic administration. 218. Insulin aspart should be refrigerated after opening.
True or false?
Answer. False rationale. Opened aspart can be stored at room temperature for up to 28 days, maintaining potency and improving patient convenience. 219. HbA1c levels below 6% are ideal for all diabetic patients. True or false? Answer. False rationale. An HbA1c below 6% may increase hypoglycemia risk in some patients and targets, e.g., less than 7%, vary based on age, comorbidities, and risk. 220. A patient with diabetic neuropathy should use hot water bottles for foot pain. True or false? Answer. False rationale. Hot water bottles risk burns in neuropathy patients with reduced sensation, increasing injury and infection potential. 221. Sulfonylureas like glympyride are contraindicated in type 1 diabetes. True or false? Answer. True rationale. Sulfonylureas stimulate insulin release, ineffective in type 1 diabetes due to absent beta cells, requiring insulin therapy instead. 222. A blood glucose of 170 mg per deciliter 1 hour after a meal is above target range. True or false? Answer. False rationale. 1 hour postprandial glucose below 180 mg per deciliter is generally acceptable, though individual targets may aim lower, depending on guidelines. 223. Insulin pumps require calibration with fingerstick tests. True or false? Answer. False rationale. Insulin pumps deliver insulin but don't require calibration. CGMs, used with pumps, may need fingerstick calibration for accuracy. 224. Hyperglycemic hyperosmolar state, HHS, is treated with oral hypoglycemics. True or false? Answer. False rationale. HHS requires for fluids and insulin to correct severe hyperglycemia and dehydration, not oral hypoglycemics, which are too slow-acting. 225. Diabetic patients should avoid moisturizing their feet to prevent cracks. True or false? Answer. False rationale. Moisturizing prevents skin cracks, reducing infection risk, but should be avoided between toes to prevent fungal growth. 226. A blood glucose of 40 mg per deciliter can cause seizures in a diabetic patient. True or false? Answer. True rationale. Severe hypoglycemia, below 50 mg per deciliter, can impair brain function, leading to seizures, requiring urgent glucose or glucagon administration. 227. Insulin Lispro requires a 30-minute wait before eating. True or false? Answer. False rationale. Lispro is taken within 15 minutes before or after meals, as its rapid onset matches postprandial glucose spikes, unlike regular insulin. 228. Diabetic nephropathy requires annual kidney function tests. True or false? Answer. True rationale. Annual tests like serum creatinine and urine albumin monitor kidney function, detecting nephropathy progression early in diabetic patients. 229. A patient with type 1 diabetes can use metformin as their primary treatment.
True or false?
Answer. False rationale. Type 1 diabetes requires insulin due to beta cell loss, and metformin, used for type 2 diabetes, is not a primary treatment. 230. GLP-1 agonists like exenatide can cause nausea as a side effect. True or false? Answer. True rationale. Nausea is a common side effect of GLP-1 agonists, often temporary, due to slowed gastric emptying and central effects, requiring patient education. 231. A blood glucose of 280 mg per deciliter requires ketone testing in type 2 diabetes. True or false? Answer. True rationale. Though less common, Type 2 diabetes patients can develop ketosis at 280 milligrams per deciliter, especially with stress or illness, warranting ketone testing. 232. Diabetic patients should avoid checking glucose during illness. True or false? Answer: false rationale. Illness increases glucose, requiring frequent checks in diabetic patients to adjust insulin and prevent DKA or HHS. 233. Regular insulin is used for basal coverage in insulin regimens. True or false? Answer: false rationale. Regular insulin is short-acting for mealtime or correction doses, while basal coverage uses long-acting insulins like glargine or detamir. 234. A diabetic foot ulcer can be safely treated with home remedies. True or false? Answer: false rationale. Diabetic foot ulcers require professional care due to infection and poor healing risks, as home remedies may worsen outcomes. 235. Hypoglycemia is a common side effect of thiazolidinediones like pioglitazone. True or false? Answer: false rationale. Thiazolidinediones improve insulin sensitivity without stimulating insulin release, rarely causing hypoglycemia unless combined with other agents. 236. Diabetic retinopathy can cause floaters in advanced stages. True or false? Answer: true rationale. Advanced retinopathy can cause hemorrhages or vitreous floaters, signaling severe damage and the need for urgent ophthalmologic care. 237. A blood glucose of 100 milligrams per deciliter before a meal requires insulin in all diabetic patients. True or false? Answer: false rationale. A glucose of 100 milligrams per deciliter is within target range, 80 to 130 mg/dl, and insulin depends on the patient's regimen and diabetes type. 238. Insulin pens should be shared between patients to reduce costs. True or false? Answer: false rationale. Sharing pens risks infection and cross-contamination, and each diabetic patient must use their own pen for safety. 239. Exercise can worsen glucose control in type 1 diabetes if poorly managed. True or false? Answer: true rationale. Without adequate insulin, exercise can raise glucose in type 1 diabetes due to stress hormones, requiring careful monitoring and dosing. 240. A patient with type 2 diabetes can develop hyperglycemic hyperosmolar state, HHS.
True or false?
Answer: true rationale. HHS is a complication of type 2 diabetes, typically in older adults, involving extreme hyperglycemia and dehydration without significant ketosis. 241. Fruity breath odor is a symptom of diabetic nephropathy.
True or false?
Answer: false rationale. Fruity breath is a sign of DKA from ketone production, not nephropathy, which affects kidneys and lacks the symptom. 242. A patient with diabetes should check HbA1c daily to adjust insulin.
True or false?
Answer: false rationale. HbA1c monitors long-term control, 2 to 3 months, and is checked every 3 to 6 months, while daily glucose tests guide insulin adjustments. 243. Insulin NPH is safe for administration in emergencies. True or false? Answer: false rationale. Only regular insulin is safe for use in emergencies like DKA. NPH, and intermediate-acting insulin, is for subcutaneous use only. 244. A blood glucose of 200 milligrams per deciliter at bedtime requires skipping a snack. True or false? Answer: false rationale. A glucose of 200 milligrams per deciliter may still require a balanced snack to prevent nocturnal hypoglycemia, depending on insulin and patient factors. 245. Diabetic neuropathy can cause orthostatic hypotension. True or false? Answer: true rationale. Autonomic neuropathy in diabetes can impair blood pressure regulation, leading to orthostatic hypotension, a common complication. 246. A patient with type 1 diabetes can manage with diet alone during illness.
True or false?
Answer: false rationale. Illness increases glucose in type 1 diabetes, requiring insulin and frequent monitoring to prevent hyperglycemia or DKA, not diet alone. 247. SGLT2 inhibitors can cause weight loss in diabetic patients.
True or false?
Answer: true. Rationale: SGLT2 inhibitors promote urinary calorie loss, leading to modest weight loss, a beneficial effect in type 2 diabetes management. 248. A diabetic patient with a blood glucose of 300 milligrams per deciliter should eat fruit to stabilize glucose. True or false? Answer: false. Rationale: hyperglycemia requires insulin and hydration, not fruit, which could raise glucose further, worsening control. 249. Regular insulin can be mixed with insulin glargine in the same syringe. True or false? Answer: false. Rationale: glargine's unique pH makes it incompatible with regular insulin, requiring separate injections to maintain their distinct actions. 250. Patient education on diabetes includes teaching about the importance of flu vaccinations.
True or false?
Answer: true. Rationale: diabetes increases infection complications, and annual flu vaccinations reduce illness severity, supporting glucose stability and health.